Hi, my name is Penny and I'm a veterinary physiotherapist with an equine and canine practice, Animals Back in Action. Over the next few minutes I will be explaining why it's important to use a qualified therapist for treating your horse and what to expect from the treatment. I have a BSc Honours degree in equine science and I spent a further 2 years gaining my veterinary physiotherapy qualification. I'm also a British Horse Society intermediate instructor. All therapists are required to work within the Veterinary Surgeons Exemption Act of 1966, which means that before I treat your horse, I will gain permission from your vet to do so. I'm also a member of the Institute of Registered Veterinary and Animal Physiotherapists, which means that I have the necessary insurance when treating your horse. Physiotherapy covers a range of treatments, including massage, stretches, myofascial release, acupressure, manipulations and electrotherapies. It is not just for elite performance horses. All horses, whatever their age or level of work, can benefit from a physio treatment. Problems and behaviours that might indicate that your horse would benefit from a physiotherapy treatment include bucking, rearing, refusing at fences, putting their ears back and biting when saddling up and girthing, inability to lengthen a stride in trot and canter, shortening of a stride, having difficulty striking off on a given rein, and various other problems like that. On my first visit to your horse, I will take a full veterinary and behavioural history, including details of diet, changes in behaviour, work level and that sort of thing. I will then ask you to walk and trot your horse up for me, turn it on a tight circle in both directions and also ask it to back up 5 or 6 strides. I will then make a static assessment of your horse, starting at the head and working back throughout its body, because even if the problem is in one area, it may be that the cause of that problem originates at the other end of the horse. So it's important to look at the whole horse rather than just the area where the problem has arisen. Quite often the horse is in pain, which is why you get the behaviours that you get. So the first thing that I may well do is employ a little bit of acupressure along the acupoints which help to relieve pain, and that way the horse is more relaxed before I start with any massage or stretches that I do. So the acupoint that I will quite often use is the one at the lumbosacral junction, which is called Ba Hui. Okay, so all you need to do is apply a very gentle pressure, and this in the equine usually takes between 1 and 5 minutes. So what we're looking for is, after a few minutes, maybe some signs of relaxing, which is indicated by licking and chewing or yawning or the head coming down. Eyes have begun to soften and she's relaxing, looking as if she's going to sleep. This is the reaction that I'm looking for. This helps with the overall disposition of the horse so that I can carry out the treatment without the horse being too reactive. Another powerful tool that I can employ is myofascial release. Now, fascia is the white shiny tissue that surrounds all the organs in your body, between all the muscles, and if you were to remove all the organs of the body, the fascia would still be in the form of the horse. But very often it gets tight. Where the muscles get tight, it pulls the fascia tight. So the next thing to do is to release that fascia so that the horse is more comfortable. So if I were working on the neck, okay, this horse is quite tight through the neck, and I know that because I can feel underneath my fingers, I can feel the tone of the muscle and the tissue here. So all I'm going to do is lean in. I'm not going to pull or press. I'm just going to lean in and let my hands sink in. And again, this may take some while for the release of the tissue. I could be here for up to 45 minutes, but it doesn't mean that I'm not doing anything. It just means that the longer I have to keep my hands on, the more of a problem there is in this particular area. This phototherapy unit employs red light to act at cellular level to increase the healing rate of a wound or to give pain relief. So I'm going to use it along the acupressure points that I've already mentioned to help relax the horse and to give pain relief. So this would be held over an acupressure point for maybe 2 minutes, and if you were using it for wound healing, it would depend on the size of the wound. The bigger the wound, the longer you would employ it for, so up to a maximum of 5 minutes, and in the case of wound healing, 4 times a day. Another application that I can use with the Biomag unit is pulse magnetic field therapy, which puts a magnetic pulse of varying degrees of intensity into the horse's body. The one that I'm using at the moment, again, is for pain relief. This pad has a triple concentric coil in it. It's very powerful because of the huge big muscles that the horse has over its hindquarters, and this gives pain relief right through down into the deeper layers of muscle. Depending on the setting, I can use the pulse mag for a variety of things, including fracture repair, nerve damage repair, pain relief, and soft tissue injuries. So it's a very useful tool to have. Towards the end of my treatment, when I've got the muscles more relaxed and more stretchy, then I might do any of the adjustments that might be needed. Now, one of the more usual or one of the more common problems is hip problems. So what we do to adjust the hips or the pelvis back so that they're level is an adjustment of on the side of the lower where the pelvis has dropped. So what I'm going to do is pick the leg up. Okay. Being careful to keep it in line with the horse's body. Okay, and then I'm going to lift it up like that. Okay, and that may be all once the tissues have been softened with my other therapies. That is usually all that's required to adjust the pelvis level again. Then I would check the pelvis, the horse to stand square on all 4 legs. Bring my hands over onto the tuber coccyx and feel that they are both level. One of the last stretches that I would do is a tail pull, which stretches the whole of the top line of the horse all the way through from the tail up the neck to the poll. So what I'm wanting the horse to do is to pull against me. And hold this in at a slightly downward angle to initiate a good stretch through the top line muscles. And then gradually release it. Don't suddenly release it as the horse may shoot forward. Okay, and again another one to do is to get back to lift. So once I've done my other therapies to relax the horse, mobilise the tissues a little bit more, make some adjustments, I will quite often finish the treatment with some stretches. Now this horse is quite tight through the shoulder and has a shortened gait because she has DJD, that is degenerative joint disease. So what I encourage her to do is stretch this big muscle here, which is the brachiocephalicus muscle, by bringing her leg up, keeping her leg in line with the body and just asking her to bring it back a little bit and watching to see how much stretch I get through there. Now I will do 2 or 3 stretches on each side and then asking her to repeat place the leg on the ground, and hopefully I will find that I can loosen up the shoulder blade and get my fingers well underneath the front of the scapula. Whatever you do with your horse, whether it's just hacking or a little competition at the weekends occasionally, it's really important that you get your horse treated on a regular basis. If you have your horse looked at about every 6 months, any problems that might be brewing can be addressed before they become chronic, and this can help your horse stay sound, have a fit and active life for much longer.